When I first heard about the implant, I was a little concerned, 3 incisions, what is this going to be like? But then on the other hand, I thought, if I could get a good night's sleep, if I could wake up without a headache, if I could look at my computer screen and not want to fall asleep, that would be a big plus. I've had sleep apnea for over 20 years. Sleep apnea is a condition where you stop breathing during the night. You don't get into a deep sleep. You wake up several times during the night because you're either gasping for air or your body's just waking you up to get a breath. This went under my chin, and this was on my nose. That's how it had to go. This was not for me.
The CPAP machine is by far the most commonly used treatment, and it does have a lot of data on being effective. However, about half the people who are prescribed it are unable to use it consistently or use it enough to get those beneficial results. And we do still have some treatment options medically as well as surgically that are available. But even those options being available, we still are in need of new options.
I was really struggling at work trying to, get into my computer and stay awake. And that's when I decided, and my husband decided, I couldn't go on like this. Dr. Strollo recommended that I see Dr. Ryan Seuss. Dr. Seuss did another sleep study and said that everything that needed to be done, I had already done it. Since I met all the criteria, all we needed to do was wait for the FDA to approve the implant.
The procedure itself is relatively straightforward and involves the implantation of a nerve stimulator type device, which is used in lots of other fields. But this one in particular is placed under the skin of the right upper chest, and there are 2 leads that come off of it. One comes down against the rib cage and monitors the breathing patterns, and the other runs up in through the neck and is connected to the nerve that works the tongue. All of the hardware is under the skin, so you don't see it or feel it.
After the surgery, we had to wait 3 or 4 weeks for all the incisions to heal. Once the incisions healed, then I went back to see Dr. Seuss, and he turned the implant on.
So the device itself sits right about here, and then there's a lead that's tunneled up under the skin and connected up to the nerve. This is still healing here, and then there's another little sensor that sits right down here on the side of the chest that measures the breathing patterns.
I don't know about him, but I'm excited.
What we want to actually see is the tongue move, so we want to get this to a point, at least to start the initial stimulation, at a point where it actually moves the tongue forward. And now the stimulation's coming on here.
The impulses that I feel are like if you have a muscle cramp or a twitching if you get in your leg or your eye. That's kind of like what the impulse I feel on my tongue.
Over the next month, we'll have her try this stimulation to see how she responds to it. And we have a range set in place to optimize her comfort as well as the effectiveness and control in the sleep apnea. In a month, we're going to bring her back for an overnight sleep study in the lab then to really fine-tune the stimulation for optimal results as well as optimal comfort. A little bit stronger. This is what, at least it's recording that you're at before.
Nice.
Okay, all right.
All right.
Good night.
Good night.
Sweet dreams.
Good night. Hope you put.
We know that she's asleep. We can see it on the video monitor too. And right now everything looks really good. She has normal airflow and normal effort. She's not having any of the apneas that she was having on her previous sleep study. We're just picking up a little bit of snoring in between the stimulation, but overall her breathing patterns and her oxygen look very, very good.
But you really find out how bad you were feeling when it's fixed. And now that I've got some energy, I actually, can do some cleaning around the house. Some people may think that's stupid, but to me, being able to do that instead of dragging through the house, that I'm happy about that.